Okay. They're going to tear them apart.
Uh-oh.
That's okay. I mean, if you come in and you write one that's perfect the first day out of the chute, I'm going to go, wow, I'm impressed. Yeah, not to say you can't do it. There are also nursing diagnosis books. I know Professor Nelson has one you like, right? What was it?
Nurse's Pocket Guide.
The Nursing Pocket Guide to Nursing Diagnoses?
Yeah. It's pretty good.
There's a lot out there on the market that you can get. Be careful because they're talking in generalities. And I can see when students have, taped right out, just copied right out of it. Like I had a student about 2 years ago that was talking about alteration in nutrition less than. And one of the things she was going to observe for was poor nibbling. And this is a geriatric patient. Now that's something that Professor Nelson can talk about because she's an OB nurse. But I don't think we're going to see that in the 90-year-old.
Hopefully not.
It's true. But not I. I saw that. I'm going, no. So I knew what the person had done. They had gotten one of those books and they were just generically taking problems out and then just putting it on the care plan. So in these books, they're going to give you NANDAs, like alteration in nutrition less than, and then generically they're going to list lots of things that could cause that problem, covering a whole myriad of nursing that we do. Med-surg, OB, pediatrics, psychiatry, right? It's got to be specific to your patient. You can't just write things that have nothing to do with your patient. The rationale piece of this is what is the rationale for the interventions? That's what they're talking about with the next piece of this, rationale. I'm going to observe this, this, and this, and then the rationale is why. That's what the rationale is. Why? Okay. So that's what goes into that column. I'm going to assess their pain. I'm going to ask them on a scale of 1 to 10, what's their pain? I'm going to observe it for any grimaces or frowns. Why? That's the rationale. Okay? And then the last one is evaluation. Now I don't have students evaluate each intervention, at least at your level. I have students give me one big evaluation for the problem. How do you two do it?
It's very loose because usually quite often goals aren't met, especially the long-term goals, So
Right.
it just depends. Right. Yeah, just depends.
Right.
Just
So
depends.
it's really going to depend on what the problem is you're talking about, but I don't ever have anybody evaluate each intervention. I just ask you, if you possibly can, to evaluate the effectiveness of this plan. Now, as nurses, we can do these care plans, and we can end up evaluating it and saying, you know what? It just didn't work. We got to do something else. And that's okay too. All right? Now, the last thing I want to say about care plans is by the way, and I was telling this to the adjuncts yesterday, how many pages is this thing? 18? Is it 18 pages? Here we call all 18 pages a care plan. But the care plan is this. This one page is a true and real care plan. It starts with a NANDA related to as evidenced by. The other 17 pages is helping you gather the information to safely take care of the patient that you've been assigned to next week. Okay? It helps you find and locate the diagnosis, the medication, the lab, the treatments. All right? So in the real world, if you will, this page, this one document, is a real and true care plan. And it's a living, breathing document. So what that means is you go to a hospital, you can look under the care plan section, and you can see 5 or 6 care plans. You should see the nurses addressing them every shift. And they look at it and they read through it and they say, oh no, this needs to be modified, and they modify it. Or, oh, we've reached this goal, this problem no longer exists, and they discontinue it. Or they look through the problems and say, well, this person has developed a whole new one, and I've got to write a new one. So please understand that it's a living, breathing document that is added to, discontinued, and changed on a constant basis in nursing care all around the country. All right? And so when you hear care plan, it's really just talking about this last page. When your instructors want you to turn in a care plan, they're looking at 18 pages of stuff. All right? So what has to be turned in brand new every week? The physical assessment sheet, the critical thinking paper, and a new NANDA.
Let's also tell them for the rationales, we don't use the PFA method, pluck from air.
I've never heard that. Plucked from air.
Pluck
method.
PFA.
Okay.
Where do we get those rationales? Where do we get why we do?
Go ahead.
Where do we get them? Well, you're on camera, so you take it. Take
Where do
it
you-
away.
Weird. When you look up and your rationales come from books, they come from nursing diagnosis, they come from knowing your patient and considering why that intervention is going to work. All right? So we don't, just make things up is what she said.
And you're going to want to provide a reference for that. That's
Do you have them actually write the
I
reference?
do. Yes, I have
what
them
she's
provide a
saying
reference.
Is that when you finish the care plan and you've had to look these things up in books, just somewhere on the bottom or on the back, reference whatever source you used. It could be Lewis. It could be the nursing drug guide that you used. The nursing and diagnosis book you used. Whatever the reference is, just throw it on the back.
Does that need to be full AK format? You just want us to write the title?
You need to write it correctly.
Okay, I'm just asking what you
Just write the reference. Yeah, it's APA formatting. Please, everything from now on to the end of eternity, so long as you're in nursing, APA formatting. All that MLA stuff, throw it in the garbage. Useless. So what Professor Gray's asking you for is after you've determined what you're going to do and you've come up with a reason for it, then make sure that you just reference where you got your information.
Yeah, that's nursing theory. What's the theory behind it?
Any other questions? It's a lot, isn't
You
it?
done?
This is brand new stuff, and it's 18 pages worth of brand new stuff that most of you have never heard of and never worked with. The physical assessment sheet, the critical thinking paper, and a NANDA. I think I've come to the end of the care planning, right?